Namaskar, dosto. Good evening, Sat Shri Akal, Salam, and Namaskar. I hope all of you are doing well. Today, again, we are with one more episode of Dr. Seema Pandey's talk show, The Knowledge Shots. I, Seema Pandey, with my friends Dr. Anuradha Khar, Dr. Raj Lakshmi Wala Valkar, and the third one is not here, Dr. Arshik Bal, present you with a very highly promising youth who is doing an excellent work in a field which is really, really neglected by we, the clinicians, and that is our mental health. So, friends, we are going to talk about impact of mental health in a couple's fertility journey, and are we doing enough for that? Before I go further, I would like you to introduce to Dr. Diksha, Mr. Diksha Singh, and Diksha, welcome on board. And I would like you to introduce yourself.
Hi everyone. So my name is Diksha Singh. I'm a counseling psychologist. I've been working as a counseling psychologist for almost 2 years now, and I've worked with a lot of couples who've gone through their IVF journey. And I really feel that it's so nice to see everybody out here taking a step up and talking about mental health. Firstly, because we live in India and we know the kind of stigma that surrounds the whole topic of mental health. So, firstly, I'm so thankful to Dr. Seema for bringing up such a topic over here. It is so essential. And then when it particularly goes with the people who go through an IVF journey itself, it's so tough, not just physically, but I'm so glad that she's talking about how it takes a toll on somebody's mental health as well. So I'm really thankful for this opportunity, first of all. Thanks a lot.
So, Diksha is from Lucknow. I wanted her to introduce herself. So she's from Lucknow and she's taking care of many couples and people and trying to improve their mental health. I welcome Dr. Arshik Bal also
Hi,
in the show. So, what is
sorry for the
mental?
inconvenience. I am on highway and might be connectivity is also bad. So
You
just
put
bear
a
with
light
me.
on your face at least.
So,
Yeah.
to begin with, Diksha, first of all, what is mental health in particular, which we are talking about? Could you tell our viewers that how different it is from our physical health and how important it is?
Okay. To easily sum it up, I would, in a single line, tell that it's just your emotional well being. When I say how how somebody tampers with your social well being, your psychological well being, or your emotional health, that all sums up being healthy mentally. That's how we talk about mental health. When we talk about anybody, I feel I have this whole nara, I would say that I feel sabko therapy mein dalo, because I feel all of us need therapy, right? I feel it's not just somebody. So in India, especially, like I talked about stigma, people feel that you need to be disturbed only. That's how you go there, and we are labeled as pagal. But I feel that everybody faces some kind of stress mentally. There is exhaustive load. We feel mentally exhausted sometimes. It's not sometimes that when our body feels tired. We mentally also feel tired sometimes. So I feel everybody should be taking some care of their mental health as well. So that's where your mental well-being comes into play.
Yes. So, Dr. Raj, me, Arshi, and all of us, we are looking at these couples all the time who are coming to us with this infertility problem. They are undergoing therapy, and most of the time, we give them medications. We try to tell them how frequently they should be making physical contact and how frequently they should be taking all those medications and things. But don't you think that when it comes to their emotional well being, which is something I really, really get concerned about, we never think about? Though we have started thinking, but what is your protocol? How have you looking at those couples, what is your interpretation of majority's mental well-being and what kind of treatment they require or need?
See, we have always known from our research papers that
a wide range of mental, I wouldn't call them problems, but a wide range of mental stressors are present for these couples. And depending on which research paper you pick up, anything between 25 to 60% of couples that you deal with in your daily life will have some sort of a challenge. The mere fact that they have to accept that something was not right. Reproduction is considered to be something which is the endpoint for the human race because the race has to go on, and it is supposed to be something that has to come naturally. And these couples, when they have not managed to do it naturally, the amount of stress that they come with, the stress might come from the fact that they are lacking behind something that others find so easy to do. The stress might come from the fact that they are not fulfilling their family's wishes. The stress might come from the fact that something that they desperately need and they're desperately fighting for is not is like not coming easy to them. The social pressures and the social stresses that come around. So basically, all these things do add up. And by the time a couple comes to us, na, they've gone through a lot. They have gone through those stanas that happen at marriage functions. They have gone through seeing their younger siblings fall pregnant very easily and deliver. They might have gone through a few miscarriages. So when a couple comes to me, the first thing that I do is I so my sort of first ever consultation, even my medical consultation with them, happens to be at least a 45 minutes to an hour long because you need them to, so you need to give them time to be able to speak. I do not go very dogmatic 1, 2, 3, 4. Okay, now tell me your menses, tell me your medical history, tell me your surgical history. I don't do that. I allow them to say their story. I allow them to talk to me about their journey. I allow them time to, explain where they stand in their journey. After which I start medicalizing things, and that's something that I sort of done ever since I started with fertility because in the NHS, very typically they would give us an hour slot for a new patient, and filling up an hour for a new patient only on medical things does become difficult. So that is where the communication with the patient and trying to be a supportive element in their journey came from. And luckily for me, I have continued doing that because my practice, as you know, is shared with my younger sister. So I can spare that time because there are like two people to handle the workload. And that is something that I have done very consistently. So that's how I get started. Seema, you're not audible. Unmute yourself, Seema.
Diksha, what is your take on this? The
Ma'am, I.
way,
Mhm.
hmm,
No, no,
the
please,
way
please. I'm sorry for cutting you
Dr.
off.
Raj is dealing with this thing, is it one way definitely for dealing with your mental status, or if you keep telling that speak, talk to friends, talk to
Right.
relatives, talk to anyone who listens to you with an empathetic ear, and that solves a lot of problems. So you are recently when I met you, you have been going to a lot of places and a lot of for infertile couples, they are coming to you and listening to them. What was your take on that? Are they being heard, or is it the way we the clinicians are dealing with these patients, is it the correct way?
Ma'am, I think firstly, I want to really, really appreciate the way Dr. Raj Lakshmi is going forward. I feel, being a listener is such a beautiful thing to do to anybody. In this world, I think we're all wanting to communicate, but we don't find somebody who can listen to us. So the way ma'am said that, she just does not jump into the medical history of the client. She first talks about, general things, wants to understand what their journey is like. So that makes the person feel comfortable also. And I also feel with all other clients that I've seen at different various centers, one thing is, for doctors, I think patients have made up their mind कि इन्हें तो बस पैसा चाहिए, क्या पता हमारा रिजल्ट पॉजिटिव आए या नेगेटिव आए, इन्हें कोई फर्क ही नहीं पड़ता है. But we, when we become empathetic towards them and they see that we are, taking a genuine part in their journey, we are genuinely there for them, we understand what they're going through, they themselves feel so much more comfortable. And then of course we've seen there's such a beautiful correlation, there's a good high correlation between mental health and your physical well-being. There are chances of having better results, positive results, once you feel better. I'll wait for Dr. Seema to join us back.
No, 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 you continue. We
Can I
don't
continue?
stop. Yeah, we don't
Okay.
stop.
Okay. So, yes, like I said that, and I want to talk about the toll that these people take. I especially see when mental health is talked about, men really, men stay behind, even when it's IVF, because they feel procedure, so it's happening with the woman, it's happening with the wife. So, but nobody asks them, when their sperm analysis or their semen analysis reports aren't good, how does that attack their male ego? Why does nobody talk about it? Because I feel that they had this one sense that, I had just this one role to play in this whole journey. They genuinely, like, I've had a client who literally said कि मैम मेरा तो एक ही काम था ना, बस सीमन ही देना था और वो भी मेरा लो रह गया. तो इतना मेल ईगो पे इतना बड़ा अटैक हो जाता है ये. और मेल मेंटल हेल्थ के बारे में तो कोई बात ही नहीं कर रहा है. Nobody is talking about it. So I felt so nice when he had the courage. I would genuinely say it was the courage to bring this topic up, because everybody feels it's the woman who will be going through hormonal injections, carrying the baby, the embryo transfer, everything. But who talked about the man over here? His masculinity was summed up in that semen analysis, and nobody took interest in the same. Yes,
So
Dr.
that's
Anuradha.
that's where whenever we talk to the patient, we don't talk only. See, generally, the woman will come with her mother-in-law or mother or sister. So I insist that the couple has to enter my chamber first,
Right.
because in that, yeah, because both of them, one, to whenever we counsel them, it's like one on one with the couple, and we don't have to repeat it every time, right? That is one is convenience.
Mhm.
Second, you get to know the body language of the couple. I mean, how they are with each other. And what I say is, whenever they start calling each other something or the other, so I call it the blame game. I will stop them there and I tell them that this, we are not in a blame game, that the wife has no ovulation or egg production, and or the guy. So it is we are a unit where it's like a chariot with wheels, and you are the you wheels, two wheels, and you have to pull it. So that's how I deal with it. Yes, you are right. When the in-laws find out that the son-in-law has a problem, the whole system, the tables turn over, actually.
So
And
true.
yeah, and they all start bombarding that poor guy. He just hangs his face in shame as if he has done something bad. And similar goes to the woman whose in-laws come with her, and they said ki she is not producing a child. I think the problem is in her, and always the female is first, literally cursed that she's unable to produce. So that's where I think it's not only man or men mental health, it is both the couple's mental health is
Absolutely.
what I feel.
So, Diksha, when a doctor or a couple comes to you anyhow, and you are talking to them, what are the parameters you look at to just decide on the scale of 1 to 10 where their mental health exactly is?
So, Bam, firstly, we also have like a MSc where we try to take a mini mental examination, mental state examination. And I usually try to take a PHQ-9 with them. That's the patient health questionnaire. So it's always good to fall back on an assessment to see where the client stands, how they are doing mentally. I'll briefly tell you that the questionnaire talks about a few basic things like your eating schedule, your sleeping schedule, and if there have been any ideations, and how just you manage your day, because I think these are some of the basics, and also touching upon the sexual health of the couple, how the communication pattern is. These are a few parameters where you can just normally through a brief sight see how the couple is doing together. So that's something that I start off with, to see how they are doing mentally, how are they dealing with stressors if they are any. And I just love how Dr. Narada said, that it's them together against the problem. The two do not need to blame each other. कि तुम्हारी वजह से हो रहा है, तुम्हारी वजह से हो रहा है. It's them versus the problem out here. So that's how I try to sometimes assess, where they are lying over the whole scale. And sometimes I do fall back on the quantitative measures, take up assessments to see the gravity of the situation.
have one question, Diksha, that
Yes,
you
ma'am.
said you give them a questionnaire and all.
Mm-hmm.
Um, do you include, just to gain confidence of the couple, do you include how well you know your spouse? You know,
Right, ma'am.
you get an idea how about the marital harmony or disharmony.
Right,
How
ma'am.
well you do on those lines, because marital disharmony is very, very common in infertile couples.
Absolutely, ma'am. So that unfortunately, I do not fall back on the assessment for that, but it's basically the communication. When I'm talking to them, it's usually, like you said, it's easier to gauge when you're just talking and you see who answers. If there is this whole gender inequality and there's patriarchy preventing them, and it's just the male talking back, or is there like a blame game? इनसे बात करिए, ये बताएंगी. So you can just easily see and guess how the relationship looks like. Is there some equality or is there a change of dynamic? So that's how I try to gauge. And then, of course, I use a lot of humor to talk to through them, make a rapport, build a rapport with them, and try to seize through that, there are different things that the two of you need to do for each other. If she's not eating well, then, why don't you sit and eat with her? Or why don't you remind her to eat? So that's how I try to bring in things. And, I talk about communication because a lot of times I've had couples who say, Ma'am, आप ये इन्हें बता दीजिएगा ना. तो I look at them and say, मैं क्यों बताऊंगी? आपके हस्बैंड ने आपको बताना चाहिए. So it's enabling them to talk to each other. We aren't the bridge, they need to be communicating with each other.
Diksha, usually when a couple is undergoing this journey of,
Mhm.
suppose there is an IVF couple, so how many times minimum do you talk to them, and what kind of difference have you been noticing after your first session, second session, and third session?
Okay. So I'll be honest, I have a structure in mind already. I try to take up 5 sessions, particularly for a couple who's going through an IVF journey. The first one is right when they get registered as a couple who wants to opt for IVF. At that time, I try to build in rapport, try to understand कि IVF क्यों choose हुआ, अच्छा ठीक है, ट्यूब बंद थे या whatever reason it was. It's basically trying to build rapport, introduce myself and things. The second one, I try to take at least with one person and try to gauge what's happening on their part because I want not just the individual but also to understand the individual's mental health. And I try to place it somewhere during the time where the stimulation process is happening because it's physically also a little tiring for the lady and for the husband also sometimes कि हमें आना पड़ रहा है मैम और दर्द भी हो रहा है कभी कभार नील भी पड़ जा रहे हैं एंड मैम कितने इंजेक्शन लगेंगे कितने दिन लगेंगे आज टीवीएस भी हुआ so I make them during that session second session make them feel I'm right here I'm with you and it's getting better and I also make them feel in touch with the doctor I tell her see she's doing her work she's doing your tvs she's trying to understand how many injections do you need so that's how I try to build a rapport that at that time second, I usually try to place during the retrieval process, that's the egg retrieval process. Because again, that's also a little scary for the couple. They feel quality pata nahi kaisi hogi, kaisi nahi hogi. So again, I like to be around during that time. One, of course, is when we have the ET process happening. They are scared. It is sort of the D-Day for them. And again, I think the path where you have to wait is the most mentally tiring for a person. I always like to give this example कि एग्जाम है आपने दे दिया और अब 15-10 दिन बाद रिजल्ट पॉजिटिव आएगा नेगेटिव आएगा वो ऊपर वाले पे छोड़ दीजिए और उसमें डॉक्टर की भी गलती नहीं होगी आपकी भी गलती नहीं होगी क्योंकि शायद अपने बस में आप लोगों ने you've played all cards right you've done all of it it's like an exam that you've given and we really can't control what the marks are going to be like so that's how I try to be with them throughout the journey, throughout stimulation, egg retrieval, embryo transfer, and then till the result comes out. If it's a negative cycle, I of course tell them to take a while. If they already have a couple of embryos left, they can always try for another transfer once their body feels better. And if there's another cycle coming in place, and if it's a positive, then also try to teach them about Garbh Sanskar, trying to tell them now it's a positive, take care of yourself, do a little bit of yoga, a little bit of walking, and telling them that not to be scared. I also feel वो भी stigma होता है कि हमारा तो IVF baby है तो फिर हम बैठेंगे नहीं हम उठेंगे नहीं I will not take stairs मैम मैं ये कर सकती हूँ तो I genuinely tell them natural pregnancy ही है आप जो precautions तब लेते हमने बस it's called assistance no we it is assisted reproductive therapy so we assisted you But now you need to take care of yourself just the way somebody, of course, take your precautions, not that way. Go for your regular checkups, but you are not supposed to be scared to sit down, stand up, and things like that. So, again, that's something about your mental health again. You're so scared, you're so anxious, so nervous because you tried something new, something different from the other couples. So, I try to brace them through that period as well.
Diksha, I want to ask you one important question
Yes, ma'am.
because we in metro cities we deal with a lot of working women compared to smaller cities. Of course, now smaller cities also have a lot of working women. So the first question they ask us, ki, should we take off?
Hmm.
Should we quit the job, private
Right.
jobs? So can you give tell the people who are watching, the general public, that how should they deal with if they become pregnant positive, or even while they are undergoing IVF, do they need to take total off, be away from work, and when they get pregnant, do they need, or should they continue with their jobs? This is very important because this is the
Right.
most common question.
Right. So I of course know that you all play the main role out here because you of course it's a very customized process, right? कि कौन सी cycle थी कैसी थी. That totally depends if your doctor advises you to rest. For sure, take your rest. For sure, take your days off. Otherwise, you've like I said, it is assisted. We are trying to help your embryo reach there, be placed there. Take care of yourselves normally on your day-to-day life. You do not specially need to take offs. You just need to take precautions. Of course, do not go running and jogging for 4 or 5 hours straight. Take care of yourselves the way you would normally do. And like I said, the way you take care of yourself if it would have been a natural conception, try to take care of yourselves the same way. Do not be overstressed. Do not exhaust yourself physically or mentally. Try practicing yoga. And again, when I say yoga, shouldn't all of us be doing a little bit of meditation, mindfulness, and yoga every day? It's for all of us. So just try to go simple, ease yourself, ease your body. And yes, you do not need to specially take breaks unless, sorry, it is customizedly, effective for you and your doctor has advised you to do the same. I know, like I said, कुछ नया कर रहे हो आप, एक अलग तरीके का कंसेप्शन है तो आप डरे हुए हो, एंड आई थिंक उस चक्कर में यू ओवर डू योर सेल्फ. यू डू नॉट नीड टू ओवर डू, ओवर कॉम्पेंसेट नहीं करना है. डॉक्टर सीमा.
Yeah, Diksha, there are, I think Dr. Raj and Anu, they'll agree. So here, the whole motto of this program is there are many couples who come to us, they are stressed and they are depressed, in fact, because of this fertility, but they do not understand that they are depressed. So, what are those red flags? I want through this program, I want these couples to understand if these things are happening, they require help. इट्स हमेशा जरूरी नहीं है कि आपके पास कोई काउंसलर हो, कोई हो. आप अपने डॉक्टर से भी इसके बारे में अगर बात करते हैं तो शायद आपकी ये प्रॉब्लम सॉर्ट हो जाएगी. सो व्हाट आर दोज रेड फ्लैग्स इन अ रिलेशनशिप during this journey which should one look for, and by which one can understand that they are going through some real problem and they need professional help now?
Right. So if I go individual wise, I feel if you're not eating well, you're not sleeping well, and you have preoccupation of thoughts. Agar aap constantly, your life is surrounded just by the idea of not having a baby, the absence of a baby is the constant thought, and you're not eating well because of it, you're not sleeping well. हम बस यही सोचते रहते हैं कि आगे क्या होगा, हमें दिन भर यही ख्याल आता रहता है. That means this baby has taken over your life. You're not taking care of yourself. You're not doing anything else that's productive. And even if you're trying to, you're getting distracted. Attention ही नहीं लगा पा रहे हो, अच्छे से खा नहीं रहे हो, नींद पूरी नहीं हो रही है, you're skipping meals. That is the part where you need to take therapy. You need to talk to somebody and, feel better by sharing things at least. And especially when it comes to a couple, I think people do not talk enough about disorders like vaginismus. I think they do not talk about things like erectile dysfunction. If you feel that your sexual life is not happy, or if not even happy, if you're not satisfied enough, or there is something that you feel is not up to a level, talk. Firstly, communicate with each other, and if not, then do talk to your doctor about it. I know we all have this shame, stigma surrounded through all these things. But if you do not open up, we will not be able to help you, right? So, talk about how during a process, during a sexual act, you felt a lot of pain and it was unexplained for, right? That is how we talk about vaginismus. That's how it comes into play. Or about, like I said, if you do not talk or communicate, if there is barely any sexual intimacy that's there, there is no communication out there, your needs are not talked about as a couple, then I think you should take therapy and, of course, talk to your doctor. And if it's taken over your relationship, your family, it is something that needs to be talked about. These are some major red flags which need to be highlighted.
Diksha, I have a query there. Seema
Mm-hmm.
is very usually picked up on depression because depression is a very strong, underlying issue that we come across very often. There
Mm-hmm.
is like a little amount of disengagement between the couple. But we know that mental health can surface in other ways also. It could be severe anxiety, it could be severe withdrawal, they could be in denial. So I'd
Right.
like you to touch upon each of these in short. And
Mm-hmm.
then at the end, I want you to specifically, so some people, after a bad result, do go into denial, or after a negative result, do go into denial. And getting out of denial becomes very difficult. And if it's like, one part of the partnership goes into denial, the other partner has to really struggle. So I'd like you to end your answer with specifically concentrating on that. Thank you.
Okay. So, firstly, I'm really happy that we talked about. I mean, you mentioned a lot of disorders right here. So, I feel an easy way to put out a disorder is when something is out of proportion. There is sadness. Sadness is something you might experience, even if it's I feel sad today, I feel sad tomorrow. But if it's prolonged, it's there throughout. I feel sad almost every day. Then that's problematic, right? I might not, it's physically also the same. I don't feel hungry today, I don't feel hungry tomorrow. But if it's something that's I'm experiencing on a daily basis, it's prolonged in a level and it's out of proportion, that's alarming. And I think a second way to, get it that you might be on a track that's a little scary is not just being out of proportion, but also a part where you feel that it's happening every day and it's unexplained for. I've seen a lot of people say कि पता नहीं बस मन उदास रहता है. You keep asking them कुछ तो हुआ होगा ना, and they say कि नहीं मालूम नहीं बस अच्छा नहीं लगता है. अगर इतने दिन से आपको अच्छा नहीं लग रहा है, रोजाना अच्छा नहीं लग रहा है और वो अनएक्सप्लेन्ड फॉर है, कोई यू आर नॉट एबल टू पुट अ फिंगर ऑन द रीजन एज वेल, यू नीड हेल्प, right? There might be a lot of traumas which, through defense mechanisms, we might have pushed away into our unconscious. They need to be talked about. There must be something out there. कुछ ना कुछ होगा जरूर जिन बारे में बात करनी चाहिए. The same thing is for anxiety. आपको आज घबराहट हो रही है, कल हो रही है, फिर अब छोटी छोटी चीजों पे हो रही है. It's happening every day, and it's also hampering your other parts of your life. अब आप काम पे ध्यान नहीं दे पा रहे हो क्योंकि रोजाना ही दुखी या घबराहट महसूस हो रही है. So that's wrong. You're not eating well, you're not sleeping well, you're not able to work, not concentrate on work. That's where I feel that the red flags are. When you notice that it's hampering other parts of life, is when it becomes alarming for us. The same is if we go to according to a DSM or an ICD level, according to the classification of disorders through mental health, we have certain time periods. If it's for 6 months, it's a level. If it's a 3 months period, then it's a small level. But again, easy ways, मतलब साइंटिफिक चीजें ना लाते हुए अगर नॉर्मल सरल भाषा में कहा जाए, तो बस जब रोजाना हो रहा हो, बिन वजह हो रहा हो और बाकी सेक्टर्स ऑफ योर लाइफ को भी हैम्पर कर रहा हो, तो गड़बड़ है. यस
So
मैम.
here, yeah, I would like to add certain more things as we, the clinician, keep encountering. It's
हम्म.
not always that आपका मन उदास है. Sometimes that unexplained anger, suppressed anger, irritability. Most of the time जब मैं कपल से बात कर रही होती हूँ तो हस्बैंड उठते उठते मतलब they get impressed, they get close to me and then वो चलते चलते कहेंगे मैडम कुछ तरीका बता दीजिए कि इनकी इरिटेबिलिटी थोड़ी कम हो जाए, थोड़ा ये गुस्सा कम करें. स्पेशली जो बहुत एडुकेटेड कपल है, बाकी जगह तो वो ये चीज नहीं समझ पाता है. सो वो डिरेंजमेंट ऑफ देयर टोटल थिंग एंड उनको बात बात पे गुस्सा आना. बहुत सारे फिजिकल साइंस as you talked about vaginismus could be an indirect sign of that psychological stress, because this couple is totally bent on getting a child. Their physical intimacy is just moving around that unexplained pelvic discharge, PV discharge, PV discharge, PV discharge, and you are not finding anything. The real reason is she is not satisfied sexually. Her needs are not met, as you said. And all those things, those are the red flags for a doctor. And I understand कि हम as a clinician कभी कभी आपको उतना टाइम नहीं अपने पेशेंट को दे पाते हैं कि उनकी ये सारी चीजें निकलवा पाए, और वो इतने वेल इक्विप्ड नहीं होते हैं कि वो डायरेक्टली चीजों को बता पाए। वहां पे देयर कम्स द रोल ऑफ अ काउंसलर, अ साइकोलॉजिस्ट, who can talk to them, who can extract these things. And that's how we have started understanding the role of mental health, importance of that mental health, and how to keep it in a better not position, in a better form. So Raj, looking at Anu is looking at most of the IT couples. You are looking from people from metros. Are their concerns somehow different than what I am looking seeing in my village and my tier 2 city? When it comes to their dissatisfaction, it's expression.
The expression probably might be more enhanced when we are in a metro, because in a metro, people tend to be more educated. They tend to have their own particular careers, and so when they start talking, they might be able to vocalize it maybe in a better way. But I feel that the stress or the pressure that an infertile couple will go within themselves, with the society and with the families, being there, increasing their stress levels, that is going to be there irrespective of where they are. I think, couples at your end, probably the woman suffers more because, typical village setup, the lady is supposed to be a homemaker. The guy goes generally out and comes back. So for her, there is no society near to her, which is of her own. She's now, gone and staying with her, in-laws. So probably women in your area, Seema, in my opinion, have more challenges dealing with these things. कि वहाँ पे कोई अपना होता है नहीं होता है. Women in metros, at least they're like going to work, they might have a friend, they might be going out, they're more likely to keep in touch with their, maternal side family. So I think the type of stress that people go must be exactly the same, irrespective of where they come from. Maybe able to vocalize about it, or the capacity to ask for help might be slightly better in the metros, and with the IT population that probably Anuti.
Yeah, I agree with Raj. I mean, since we are seeing more of educated class who are placed in good jobs, who are financially independent women, and I think they do talk about it. They do come out. No, maybe not in the first meeting, but eventually they do come out of it with all these problems. Now, I have another problem here is that the working hours, Seema, Dr. Seema. What we have here is, if it's a US based company, the whole of the circadian rhythm here changes. And your sleep goes for a toss, your hormones go for a toss. So if you are a US based, you will be working in the night and you'll be sleeping during the day. Australian, again, there is time. So basically, there is time change, which our couples are struggling with. Now, if the husband is in a UK company, still he has got time, and in the woman is wife is in a US based company, they don't have time to interact to each other. They have different work timings, and the intercourse is not happening. Now this is a very common thing, and probably a lot of couples tell me that hardly in the weekend, Saturday or Sunday, see, the intercourse becomes a weekend affair, like, because weekends, if they have holidays, okay. Now another thing is that they say we get so tired, we lose interest in intercourse. I mean, a young reproductive age couple, they should ideally have intercourse every day, say 25 to 33, 34 years old, if we talk about that younger age group. They are not. Majority of the couples are not regularly having intercourse. That is another thing. So it also could be a cause of infertility. Stress at work, yes. Now stress at work is like office pressure, more digital, they're always on the laptop, and they're always stress, meetings, targets to meet. See, these are the things which have to be addressed when you talk to a couple. And I am also talking about the societal pressure, the peer pressure. My friend has conceived in the first year, and I am still waiting. So, peer pressure is also high here. My cousin got married after me, and I don't have a child, and she has a child. Now, that pressure also is there. So, I think we have, but yeah, the women are more forthcoming. And I think the couples, when they come, even the husbands, the way they talk and all is a bit different. And not too much of a blame game for this class of people, they, because if the husband sometimes does acknowledge that, the mistake is our both, we both are to be blamed. And that also happens occasionally. So this is what we see here.
So, looking at all the causes, ultimate effect is on that couple as a unit is suffering from all these things, all said and done. So, Diksha, here I would like you to give some solutions for these couples who are undergoing this fertility journey. How should they plan their days? What are the things which they should be doing, maybe together or independently, to keep their mental health at peace? They are at peace and their mental health is not taking its a toll of this fertility journey.
Right, ma'am. So something that I usually, it works for all of us. Even if I am having a couple or a person who is troubled with work-life balance, I have this one perfect solution that I give everybody. So it's just an example. So if there's Diksha, and Diksha is 100%. So there's a lot of things that make Diksha, right? So there's 10% of probably mama papa, 10% of my profession, 10% of my gym, 10% of food. So there's a lot of things, these 10 percentages, or probably my siblings are my 5%. Having a baby is a 10%, and these percentages keep changing also. Okay, so आज प्रोफेशन 10 पे होगा, हो सकता है कल 20 पे चला जाए. तो इट इज इम्पॉर्टेंट कि उसको 10% ही मिलना चाहिए ना. उसको अलाउड नहीं है कि वो मेरा पूरा 100% ले जाए. So if I am with mama.
Compartmentalization.
Exactly. That's just compartmentalization. So if I am with mama papa, it is just with mama papa. They are my 10% and they also make up Diksha, right? So that 10% goes to them. And if I am at the gym and that's my 5%, I am at my gym. I will not take up work calls then. I'm also supposed to respect my body, take care of it, right? That is my time at the gym. I do not take up work calls then. I do not take home calls then also. I tell them this is my time there. And just the same way, you can't pressurize or be dependent on this baby and give it your 50% or your 100%. They all make up little parts of you, and you shouldn't be dependent on any one part. I shouldn't all day long be at my partner. मेरे पार्टनर को भी हक नहीं है कि वो मेरा पूरा 100% ले जाए. क्योंकि आई एम श्योर उसका भी एक 100% होगा ना. उसको भी मिल के कुछ चीजें बना रही होंगी. And he is also allowed to have his 100%, and Diksha can be a small little part of his 100%. So the same way, all these people who are trying or opting for an IVF journey, your baby should be a small percentage of your 100% together, and it should not take over your 100%. Put your percentages there, and like I said, these percentages keep changing. They're supposed to change every day. That's okay. God forbid if I get up with some disease tomorrow and I need to hit the gym, if I become overweight, तो कल शायद मेरा gym 15% हो जाएगा. कोई बात नहीं, पर it's not allowed to take a majority of my life. So basically, just the way Dr. Seema summed it up in a word, Compartmentalize, balance, create a balance. And they should not take over each other's percentages. Maintain that, try to give it that much priority only. They all sum up and make up you, and they're not supposed to hamper each other at all, right?
Yes. So here comes, I think we have discussed almost everything regarding this. Ultimately, when I talk to a couple and उनकी सारी बातें सुनने के बाद जब मुझे समझ नहीं आता कि मैं क्या बोलूं, sometimes 20 days together, 30 days they are not meeting just because their doctor did not tell them to have a relationship, physical relations, and they have gone into that frame of mind where it is happening just for the children. So I just tell them कि गृहस्थ जीवन का ये एक कर्तव्य है, एक पार्ट है, और आपको ये भी करना है. You do it for that, not for, and for yourself, not for making children. It's not just for that. So here it is almost 41 minutes, and this is an endless topic. We'll keep going and going. So अब हमें यहाँ पे इसको sum up करना चाहिए. Yes, Dr. Anuradha.
I have one point to discuss in polycystic ovarian disease, especially women who are obese. They are the most miserable, I feel. I mean, of course,
Very important
because
topic we were missing. Yeah.
yes, because on one hand, the moment they come, we'll tell them you lose weight, you change your diet, and see, they're struggling. Everyone is body shaming them. Okay, they feel more stressed about that. And then if they've crossed it,
Indirectly, we too, their
we
doctor
too also
too.
stress
The
them.
first
Yes.
thing we talk about is weight.
So if they are around 80, 85, 90 kgs, so the first thing it hits, it's a phenotype. No, when we see them, we will start giving them lectures on diet, exercise, lifestyle modification. I think there we have to be really, really soft and really considerate for such women, because they would have already undergone body shaming in their college, in their workplace, in their, so there I think we should take this very, very carefully and cautiously. And even if we have to convey the same message, we have to be very sensitive to these women, is what
So,
I see.
Dr. Anuradha, I totally agree with you. And as I keep telling, last year when I was attending this meeting of Androgen Access PCOS Society, the whole point topic of that meeting was body inclusiveness. So nowadays, it has taken so much. I mean, it has impacted these women in such a negative way that American physicians, especially reproductive medicine specialists and endocrinologists, they have just made some guidelines and regulation that if you are talking to a PCOS girl or a woman, you just have to ask her first, can I talk about your weight? And that has to be to come in a very positive manner, so that the person in front of you does not feel offended. If that lady is not ready to lose weight, you have to implement treatment which is that weight friendly, but you cannot just keep telling. They have gone they had for giving this example how badly it is hurting. Even if they are losing the weight, they are not getting pregnant. So this lady, she was giving the example of the food, like uh, when we were kids, we used to have dal, roti, sabzi, chawal, everything, and neither our parents, grandparents, or ourselves were obese, overweight, nothing. The same food now, this generation is eating, okay, somehow adulterated, but they are getting lot of obesity, overweightness, and all those things. And whenever a girl is picking up something which is rich in carbohydrate, everybody is starting from the Google to the doctor to the peer. No, 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 ये नहीं खाने का, इसको
Okay.
खाने से ये से होता है. So they were talking like us in negative energy. you are consuming in form of that food. Because before just taking that food, lot of people are just so, it's not only you ate, you start feeling guilty about eating it, and throughout that guilt remains, and that is not helping you to lose weight. That concept even was being discussed there, because of this thing, that body inclusiveness, body shaming, and the impact especially on PCOS girls it is having. So this is a very important point, and all my PCOS girls, we are trying to do this a kind of study where we are, it was being done in other countries, but we were not aware of. We never talk about all these things. Nowadays we are talking about how do they feel before coming to us, and what happens once they are done with the treatment, with the counseling, and with the session.
So I have one small point that will be my last probably. What I do in my clinical practices when I know, phenotypically obese patient with little hirsutism, little acne, I don't get into the lifestyle on the first meeting. I don't. Even if they ask me, doctor, what about my weight? Because weight and blood pressure is there written on the file. I tell them, let's just talk about, general things, and we come to the specific things at a later date. I never discuss, and that too, next time I'll always ask him, can we talk little bit about yourself, if you don't mind? And I tell them that, say, Mrs. X, I'm not there, I'm not body shaming you. And if you feel like that, I really apologize, but I need to talk. So it is in my second or third session I'll talk like that, so that they don't, generally people do feel bad and they feel really offended by these words. This is over period of time I've learned.
So, in the journey of PCOS, not those hormonal kicks, but this negative body image, because of this weight, hirsutism, and alopecia, that is also playing a very important part in producing that self fertility, because that female herself is not feeling good about herself, so she is not confident enough to continue that journey of a couple, which requires 100% dedication from both the sides. So as a society, as a physician, as a clinician, we have to think about people, and we have to respect their, and we कहते हैं ना कि आपने उसके जूते में पैर डाल के देखो तभी पता चलेगा। हो सकता है कि वो व्यक्ति उसके लिए बहुत कुछ कर रहा हो, लेकिन वो नहीं हो पा रहा हो जैसा वो होना चाहता है। So with this, I would like to end this session, and there is a trend, Diksha. Before leaving the set, we all of us give our three best shots from this session. Since you are our expert panelist, and looking at the clarity of your thoughts, your knowledge of your subject, and the way you have articulated and expressed them, I'm really proud of you. So please, we'll start with your three shots.
Okay, so I'll probably try to go as candid as possible. One way would be how Dr. Raj Lakshmi ji talked about how she maintains and builds a rapport while talking and does not just follow a structure. So that was one good shot for me. The second one would be this part where Dr. Anuradha talked about body shaming. That was something we totally missed onto, and the mental health aspect of it that we missed onto, right? And I think third would be by Dr. Seema, where she talked about, just this whole IVF journey and how there are different clients, and how she mentioned that, there might be a disparity between somebody coming from a town, from a village, but how at the end the problems are sort of the same and there is a disparity, right? So I really feel that these were the three best shots, which all three of you have talked about.
No. Three best points also, but you have given excellent ones. It is covered perfectly fine. So coming to Dr. Raj.
My three shots for today are going to be going back to basics. When you sit and talk to your patient, um, of course, you listen to their words, try and understand what they're saying, but also look at their body language and try and gauge what they're not saying. because
Exactly.
that's going to allow you to come on par and allow you to get them to explore topics that they're not able to vocalize. So that's like the first thing. So, being attentive to your patient from all aspects. That's going to be my sort of first shot. My second shot is going to be to encourage them to talk. If they need time, make a second appointment, make a third appointment, encourage them to talk. Once they start talking about it, they are able to face whatever problems they have with greater clarity. You tell them that they have bad fuel, and they only go back thinking they have bad fuel, and they have questions which they have not asked. If they get a chance to ask those questions, they get a closure, they get a clarity. So, allowing patient medical closure wherever you can give them medical closure is going to be my, second shot for my clinician friends. And my third shot for my clinician friends is, we all hope and pray that God gives success to the couple who's trying. But there are going to be those couples who do not become successful at the end of a very, very, rigorous and intense journey. And that is where your role as a clinician becomes more enhanced. Sit with them, sit quietly with them, allow them to assimilate their journey, allow them to assimilate what they've gone through, and give them very, very positive outcomes and positive goals to look at, because no couple who has one failure means that the couple has failed. It's just one treatment which has not worked. It does not mean that their entire journey has become a failure. So, in whenever you do your failed cycle counseling, giving them very, very positive and specific things to look for.
Okay. So, Dr. Anuradha,
Okay, so my first shot, which I really loved today, is that 10%, 10%, 100% thing. That I think that's the take home today. That for a woman or for a couple per se, the having a baby, say they get married and then they plan a child, but the marriage is the basic, or if they are partners, that association, that companionship, that is number one in their life. And then comes the baby, and then comes the society and the work. So I love that. I mean, that I think that's the take home message, that don't get so stressed that it's always playing on your mind and it's just sitting here in your frontal lobe, and your behavior changes and everything changes, and you miss out on all the good things and fun in your life. So live your life first. Love your companionship with your husband or partner, and then comes the other things follow. So that was one. Second is, the way you give, I mean, you said that we have to give questionnaire to people to assess the kind of stress they are undergoing or the anxiety. I think that's a good way, because when they answer, they take a moment, and it's not face to face, right? They sit outside, they're waiting for the doctor's appointment, and they fill their forms. And I think those, when they feel that, that's the true thing what comes. Some people are hesitant to talk to counselor directly, or the doctor also. Some people are shy. So I think that questionnaire, I think all of us should keep in our clinics. And because we have
so you,
counselors
you
which
will
also,
receive it very soon, Dr. Anuradha.
yes, yes, we should have. We should have. I want it. And the third thing is that, um, my request to the in-laws, the society, I want to, I want to request everyone that the couple is already stressed. I think we all should help them, the clinician, the family, the counselor, and we should talk. Everyone should be in unison. It's not that clinician is talking something, counselor is talking something, and then they go back to that society and they are fine in the clinic, and they, so the society has a big role to play. If we convey this, that please don't stress them, give them time. Time itself, sometimes, if they don't have an organic problem, an anatomical problem or something, they will conceive. Majority of the people will conceive. So give them their time, give them their space. And my last one shot is, whenever I feel the patients are stressed and all, I always tell them, over the weekend, have a short break, come out of that bedroom, come out of there, supposing they're not able to have intercourse, or they're stressed, I always tell them, go for a short vacation and rejuvenate yourself and come back. Those are my shots. Thank you.
एक्सेलेंट शॉट्स। तो मैं अपने हिंदी भाषी दोस्तों के लिए बता दूं कि आज हम बात कर रहे थे मेंटल हेल्थ के बारे में, आपकी मानसिक अवस्था के बारे में। जब आपको ऐसा लगता है कि आपको प्रेगनेंसी नहीं हो रही है, आपको इनफर्टिलिटी है, या आपका ऑलरेडी डायग्नोसिस बन चुका है और आप उसके ट्रीटमेंट में आगे बढ़ रहे हैं, वो ट्रीटमेंट का स्टेप आपका टैबलेट से हो सकता है, आईयूआई हो सकता है, या आईवीएफ हो सकता है। इस बीच में, इस जर्नी के दौरान जो आपके अपने से सवाल होते हैं, आप अपने आप में जो फेलियर फील करते हैं, कि आपको ऐसा लगता है कि जो एक पर्टिकुलर जॉब आपसे एक्सपेक्टेड था वो आप नहीं कर पा रहे हैं, तो आप अपने शेल में सिमटते जाते हैं। आपका रिश्ता अपने पार्टनर से, अपनी फैमिली से और अपनी सोसाइटी से सबसे बदलता जाता है। और समटाइम्स जब आप अपने को खुल के एक्सप्रेस नहीं कर पाते हैं, तो वो आपको मेंटली बीमार कर देता है, और फिर वो बीमारी एक सर्कल की तरह बढ़ती जाती है। जितना आप उसमें घुसते जाते हैं, उसका सबसे ज्यादा असर आपके वैवाहिक जीवन पे, या जो पार्टनर साथ में रह रहे हैं आपके ऊपर, आप दोनों के रिलेशनशिप पे पड़ता है, और आपकी पूरी लाइफ इस इनफर्टिलिटी के चारों तरफ घूमने लगती है। तो आप सबको आज मिस दीक्षा ने ये बताने की कोशिश की, जो कि एक बहुत ही एक्सपर्ट काउंसलर है, और उन्होंने ये बताने की कोशिश की कि आपकी जिंदगी का 100% ये बच्चा नहीं है, वो एक पार्ट है, जो मैं आपको समय से समय पे बताती रहती हूँ कि वो सिर्फ एक पार्ट है। उसके अलावा बहुत सारी और चीजें हैं, उन सबको के ऊपर इस एक पार्ट को हावी मत होने दीजिए, और अपनी सैनिटी को बचाए रखने के लिए अपने रिश्ते में आगे चलकर, ना किसी का बच्चा किसी के साथ रहता है, हम सब अपने पेरेंट्स के साथ नहीं रहते हैं, तो बच्चा अपनी खुशी के लिए पैदा कीजिए, बच्चे के लिए सारी खुशी खत्म मत कर दीजिए। आप एज अ कपल किस तरह से जी रहे हैं, वो लॉन्ग टर्म रिलेशनशिप है, और वही सबसे ज्यादा जिंदगी में आपके काम आनी है। लेकिन सैडली उसी रिश्ते को सबसे ज्यादा चोट पहुंचती है, साइलेंटली पहुंचती है, क्योंकि आप उसके बारे में बात नहीं करते हैं, आप एक दूसरे से दूर होते जाते हैं, और इनको दूर करने की जरूरत है। एज अ क्लिनिशियन हम बहुत टाइम आपको ये बात नहीं, आपसे ये बातें कर पाते हैं क्लिनिक में बैठ के, पेशेंट्स का लोड होता है, आप भी डर के वो कई बार वो बातें सबके सामने हमसे कर नहीं पाते हैं। अगर ऐसा है, अगर आपको लगता है कि आप जरूरत से ज्यादा उदास हैं, परेशान हैं, फिजिकल रिलेशन या किसी तरह के रिलेशन में आपका जी नहीं लग रहा है, आपको बार बार तरह तरह की बीमारियों के सिम्टम्स फील हो रहे हैं, तो ये सारे रेड फ्लैग्स हैं कि आप एंजाइटी और डिप्रेशन में हो सकते हैं, और आप जिद करके अपने डॉक्टर से अलग से टाइम लेके इसके बारे में बात कीजिए। अगर आपके डॉक्टर के पास आपको लगता है कि इतना टाइम नहीं है, तो उनसे कहिए कि वो किसी काउंसलर से आपको मिलने की सलाह दें। हर क्लिनिक आज की तारीख में, हम जान रहे हैं कि सबके ऊपर बहुत ज्यादा प्रेशर है, तो स्पेशल इसके लिए, और आजकल आपको फिजिकली बैठ करके भी ये बातें करने की जरूरत नहीं है। कोविड ने हमें बता दिया कि बहुत सारी चीजें हम वर्चुअली कर सकते हैं, तो इस काउंसलर से आपकी बात वर्चुअली भी हो सकती है। दिन का कोई 10 मिनट, जैसे मैं आपको मी टाइम रखने की बात करती हूँ, वैसे ही 10 से 15 मिनट वी टाइम रखने की कोशिश कीजिए। उस वक्त भूल जाइए कि आपको एक बच्चा चाहिए, या आपकी सास जी क्या चाहती हैं, समाज क्या चाहता है। आप दोनों एक दूसरे के बारे में बातें कीजिए, कोई साथ में हॉबी कल्टीवेट कीजिए, कोई ऐसी आदत जो आप दोनों एंजॉय करते हो, और उसके साथ वो समय बिताने की कोशिश कीजिए। यकीन मानिए कि ये जर्नी उतनी पेनफुल नहीं होगी जितनी अभी साउंड कर रही है। तो आज के लिए इतना ही, फिर मिलेंगे हम अगले हफ्ते किसी और टॉपिक के साथ, डॉक्टर सीमा पांडे नॉलेज शॉर्ट्स में। टिल देन, आपकी कोई भी क्वेरीज हो, क्वेश्चन हो, हम में से किसी के लिए, मिस दीक्षा के लिए या हम में से, आप इस लाइन, चैट लाइन में डाल दीजिए, और हम उसका आंसर करने की कोशिश करेंगे। एनी टॉपिक, be it my clinician friends or my patients and जनरल पब्लिक, अगर आप चाहते हैं कि किसी पर्टिकुलर टॉपिक पे हम बात करें, डोंट हेजिटेट, please write to us and we'll try to include that. And on this note, I would like to thank our guest panelist, Miss Diksha Singh, who was just amazing, and my friends, Dr. Anuradha Khar, Dr. Raj Lakshmi Wala Valkar. And till we meet again, good night, bye bye, Shabba Khair. Take very good care
Thank
of
you
yourself.
so much. Thank you everyone for a patient here.
Thank you
Thank
so
you,
much,
doctor.
everyone.
Thank you, Diksha.